For many years now, robotics in healthcare has been a really strong ethical issue. They're aiming to replace nurses, doctors, surgeons, receptionists with these robotic devices that will take over their daily tasks. Although there isn't an exact number of how much money the healthcare system will save, think about it in the way that they would have to stop paying individual wages for doctors and nurses, receptionists, surgeons, and they would only have to pay to make the robot and to replace any damages the robot may or may not have. They won't need to pay for annual leave or sick leave, carers leave. This will save the healthcare system a lot of money. This can mean that the government can also save money and can actually spend it on other things that are more important. Through trials in America, they've seen that these robots can actually draw blood from a patient in up to 1 minute. Statistics show that nurses could take up to between 3 and 5 minutes to draw blood from a normal patient. So this reduces the time that these robots have to spend on it. The robots are also programmed to do specific surgeries, so there's no interference, there's no stopping and starting. These robots can just get down to business and do what they need to do in order to make patients survive. Now, although there is a lot of positives, there's also many negatives. So we'll explore those now. So the main issue with these robotics is the fact that it doesn't provide the option for patient-centered care. There's no opportunity for empathy, for sympathy, for these robots to really engage with their patient, whereas nurses, doctors, surgeons are all able to have that sense of respect and rapport with their patient. These robots can talk to their patients, however, it doesn't equal the nurse's interaction with these patients.
As for the ethical theory, as a group, we decided that the theological theory relates to the usage of robotics in healthcare. So the theological theory focuses on the rights or wrongs of the consequence. And according to articles that we've read, the usage of robotics in healthcare has created negative consequences not only for patients but also their family members and staff members involved. For example, robots used as companions are not able to realistically demonstrate emotions or connect with their patients because they are machines. This takes away the humanistic side of nursing, which is a big component in nursing. And unfortunately, sometimes this also creates a false emotional bond between the patient and robot, which potentially sets up a trap for patients as victims of deception. The usage of robotics also takes away the opportunity for the patients to interact with human beings, such as their family members and staff members. And this, because of this decreases the opportunity for therapeutic relationships to be built. And this potentially affects the patient's mental health and simultaneously affecting their physical health as well. Moving on, invasion of patient privacy has also become very apparent in the usage of robotics in healthcare. For example, a robot used to monitor a false risk patient is constantly being monitored 24 hours a day. Patients have reported not feeling comfortable, not knowing who's behind those cameras, and not comfortable carrying out certain activities. And other ethical issues such as who is allowed to access this information if needed, or how long will this information be kept for, has also arisen amongst the community.
We have decided that all 4 ethical principles can be applied. Non-maleficence means to do no harm, and in this case, harm can mean several things, such as pain, injury, disability, discomfort, or death. For example, if the robots were poorly designed, they could have sharp parts that might hurt both the patient and staff. Or, if the robots gave off too much heat during use, it could burn patients. Another form of harm can be mental, such as feeling uncomfortable with the robot delivering care rather than having human interaction. This would lead to fear and distrust of robots and causing patients or staff to develop a negative stereotype from this experience. Autonomy is the main ethical issue in this case, and in this situation it can refer to two things: the right of the patient to have control over their own body and decision making, but also the level of autonomy that the robots are able to function. In relation to patient autonomy, it means that patients have the right to know about their health information as well. Some robots are built with cameras to monitor their patients. However, this may cause privacy and confidentiality issues, as the patient may not know who has access to this information or may feel uncomfortable being recorded, which may cause them not disclosing certain information. When discussing robot autonomy, there are several levels of autonomy the robots can function without human assistance. For example, the Da Vinci surgical system, which surgeons use in surgical procedures, robotic wheelchairs, which patients use to move around, and robotic nursing assistants, are all non-autonomous and require humans to operate them, whereas automated robotic delivery systems can deliver supplies, meals, and medications to patients with less human assistance. The automated robotic delivery system moves around independently and is able to take elevators, navigates around obstacles, and can even talk to people if necessary. And in the near future, robots might operate independently and possibly replace healthcare workers or relieve nurses of many tedious tasks. Justice refers to fairness and can be applied, because using these robots will require guidelines and regulations, and also involves handling patient data, which has to do with patient privacy and confidentiality. And finally, beneficence means to do good. In order to ensure the robots are used correctly to provide the best possible patient care and outcomes, hospital staff, such as nurses, doctors, pharmacists, and PCAs, should be educated and regularly updated about the technology, and it should also be incorporated into future student education.
As previously discussed, proper ethics are vital to the effective deliverance of healthcare, and there have been many different theories created to explain this concept. One of these theories being the previously mentioned teleological theory. In contrast to this consequence-based explanation, the deontological theory of ethics describes morality as the belief that certain actions and rules are inherently good and must be followed to act ethically. It's no secret that the world of healthcare is complex and ever-changing, and one set of actions or rules cannot be considered correct in every situation. A particular rule may work in case of one patient, but be considered immoral in the case of another. And, as such, it is the nurse's job to critically evaluate circumstances in order to take the best course of action and provide the best care possible. Even if they are programmed with a typically correct course of action for a particular situation, unlike their organic counterparts, robots lack the ability to sense emotions and logically process subtle information, such as a patient's tone of voice, facial expression, or body language. If a robotic nurse is created with the purpose of dispensing and giving out patients medication, what happens when a patient refuses to take it? All the robot nurse knows is that the patient needs their medication at a specific time in order to improve their health, and not the wide variety of potentially legitimate reasons that the patient may have for refusing said medication. As such, it is difficult to believe that a non-organic nurse has the capacity and skills to evaluate every situation that may arise in a healthcare setting and make an ethically complex decision which ensures the best and most moral outcome for their patient.